name is Olga Sirbu. I'm a board-certified behavior analyst and licensed behavior analyst. And in this video, I'll talk about a common yet often concerning behavior in children with autism, teeth grinding. But before we start, as always, I would like to encourage you to give this video a like and hit the subscribe button below so you can benefit from weekly information on the subject of autism. Teeth grinding is also known as bruxism, and it refers to the habit of clenching or grinding the teeth, usually unconsciously, during wakefulness or sleep. In my case, this is a phenomenon that occurs during the night when I am asleep and I'm not conscious about it. For children with autism, bruxism is often a repetitive behavior that may not only involve grinding, but also clenching the teeth or jaw, sometimes accompanied by other signs like jaw tension or facial pain. The grinding sounds may be audible, especially when the child is awake, or there could be visible signs like worn down teeth. While it's something that happens in a wide variety of children, it's more frequently observed in children with autism, with some studies suggesting that anywhere from 10 to 30% of children on the spectrum may experience bruxism. There are several common factors that may contribute to bruxism in children with autism. First reason is sensory processing issues. Teeth grinding can occur as a response to discomfort or sensory overload. For some children, the sensation of grinding their teeth or the vibration in their jaw may actually feel soothing or help them process overwhelming sensory input. Second reason is the stress and anxiety. Children with autism often face social challenges, difficulty with communication, or frustration with daily routine, which can lead to anxiety. Children may unconsciously grind their teeth as a way to cope with these emotions. Third reason is communication difficulties. When a child feels overwhelmed or frustrated and can't communicate those feelings, they may turn to physical behaviors like teeth grinding as a way to self-soothe or release tension. Fourth reason is the physical discomfort or pain. Some children with autism may grind their teeth as a reaction to physical discomfort. This could be related to dental issues like teeth that are growing in. In some cases, the act of grinding may be a response to the pressure in the jaw or discomfort they are feeling. Fifth reason is hyperactivity and restlessness. Teeth grinding can also be a response to hyperactivity or restlessness, particularly in situations where the child is feeling overstimulated. This is a way to self-regulate during moments of anxiety, excitement, or excess of energy. Sixth and last reason for teeth grinding is the sleep disturbances. 50% of children with autism experience sleep-related problems such as difficulty falling asleep or staying asleep. Bruxism can be more pronounced during sleep, often due to stress or other underlying discomforts during the nighttime. The key To successful management of teeth grinding is understanding the underlying causes and addressing them with individualized strategies that focus on reducing the triggers. The first strategy recommended for managing the teeth grinding is to create a calming sensory environment. Children with autism are often more sensitive to stimuli like their surroundings, so reducing noise, bright lights, or other overwhelming sensory inputs can help lower the chances of teeth grinding. Some tips for creating a sensory-friendly environment includes using soft lighting such as dim lamps or night lights, reducing background noises with noise-canceling headphones or a white noise machine, offering calming sensory tools like weighted blankets, soft fabrics, or sensory fidget toys to help regulate sensory experiences. Second strategy is to develop consistent routines. A clear and consistent routine can help reduce stress and anxiety, making it less likely for the child to turn to teeth grinding as a way of coping. This is particularly important during transitions, like moving from one activity to another, or in situations that are unfamiliar or cause anxiety. Keeping a visual schedule or using a timer to signal transition can help ease this process. Third strategy is working on teaching relaxation techniques. Depending on the child's age and ability, relaxation strategies may include breathing exercises, helping the child practice slow, deep breaths to calm their nervous system. Progressive muscle relaxation, teaching them to tense and then release muscle in their body, focusing on areas of tension. Calming music or guided meditations can also help the child relax before bed, reducing sleep-related teeth grinding. Fourth strategy is working on functional communication. Augmentative communication tools like picture cards, sign language, or communication devices may help the child express their needs and feelings and reduce the frustration that may lead to teeth grinding. Fifth strategy is dental consultation. A pediatric dentist who specializes in children with autism can assess whether the child has issues with bite alignment, dental pain, or jaw tension that may contribute to teeth grinding. In some cases, a mouth guard may be recommended to prevent damage to the teeth. Sixth and last strategy is work on the sleep issue. If bruxism is occurring during sleep, establish a consistent bedtime routine, ensuring the sleep environment is quiet and comfortable, and limiting screen time before bed. In some cases, if sleep issue persists, a sleep specialist may be consulted to evaluate and address the underlying sleep problems. Teeth grinding in children with autism can be a challenging behavior, but it's important to remember that it's not an intentional or disruptive act. It's often a way for children to cope with sensory overload, manage anxiety, or relieve physical discomfort. By understanding the root cause and using a combination of environmental adjustments, communicational supports, relaxation techniques, and professional guidance, parents and therapists can help children with autism manage this behavior in a way that supports their needs. Thank you for listening, and I hope this information will help you in your journey. See you in the next video.